Hi, my name is Chelsea Bucciarelli, and I'm going to be performing the Neuro and HEENT video checkoff for Health Assessment Lab. So to begin this, I'm just going to announce that I've washed my hands prior to this assessment. Normally in a clinical setting, I just walk in the room and wash my hands. Hi, my name is Chelsea, and I'm going to be your nurse today.
Hi.
Can you tell me your name?
Maria Teodoro.
And then your date of birth?
05/27/01.
Okay, do you have any allergies?
No.
And then we would just make sure that the identity of the patient matches up with our records and write down the allergies and if she has any reactions, if she states an allergy. Next, I'll be doing her vitals with just the heart rate and respiratory rate. Thank you. Okay, so I found that her heart rate is about 66 beats per minute by feeling her radial pulse for 30 seconds, then multiplying by 2, and that falls within the normal range of 60 to 100 beats per minute. And then her respiratory rate was found to be a 12, and I did this again by just watching the rise and fall of her chest. Next, we'll assess her level of orientation. So I'll be asking her questions that relate to person, place, time, and situation. Could you state your name again for me?
Maria Teodoro.
Okay, and then do you know where you are right now?
Yep, the hospital.
Okay, do you know the date?
October 29th.
Yep. And then why are you here today?
Health checkup.
Yep. And then we would state that she is alert and oriented ×4 because she answered correctly to all those questions relating to orientation. Next, I will be conducting assessments of her cranial nerves, and we'll be doing this with different tests for each cranial nerve. I'll start off with cranial nerve 7, which is the facial nerve. So I'll inspect her face just by looking at it for facial symmetry, making sure one side isn't drooping, which would show signs of maybe stroke or Bell's palsy. See that her eyes are level, such as that. And then we find that all is normal, and then I'll test her facial muscles by looking at their motor. So I'll ask you to, let's see, I'll ask you to smile, then you can frown, then you puff out your cheeks, and then raise your eyebrows. Okay, and then we see she could do all of that, so cranial nerve 7 is intact. Next, I'll look at cranial nerve 5, which is the trigeminal, which has motor and sensory. So by motor, I'll have you clench your teeth. Yeah, and then I'll feel around her masseter. Yep, and then her temporal. Yep. So all is good there, and then we'll do a sensory. So I'll do the sharp or dull test with this paperclip. I'll have the patient close her eyes, and then I'll touch her forehead, her cheeks, and her chin with a sharp or dull side, and I'll ask her to tell me which one it is. I'll have you close your eyes. Thank you.
Dull. Sharp. Dull.
Okay, and then she passed that, so that nerve is intact. And then next, I will inspect her eyes. I'll look at her lids, her conjunctivae, and her sclerae and cornea. So her lids, I would just want to close your eyes. I'll just inspect them, see if there's any lesions or abnormal colors or any other swellings or abnormalities. If you open your eyes, I'll look at her conjunctivae by looking at her lower lids by thank you. Just looking for any discharge or discharge or drainage, and you want to make sure that they're pink in there. Then I'll look at her her sclerae, which is the white parts of her eye. You want to just look and see if there's any color difference. Look for jaundice, which is yellowing of the eyes, or erythema, which is redness of the eyes. And then you want to look at her corneas. You want to just look to make sure that they're bright and clear, that there's no cloudiness or signs of cataracts. Next, I'll be doing cranial nerves 3, 4, and 6, which all relate to eye movement. So we'll look at her extraocular eye movements by taking an object and looking at her 6 cardinal fields of vision. So I'll be looking for any involuntary shaking of her eyes. So I'm going to move this object into 6 different places. I'll just have you keep your head still and look at the objects. Okay, so we're going to go. Alright, and then we didn't notice any abnormal, irregular eye shaking or movement, so that's good. And then we'll do corneal light reflex, which is normally done with a pen light, but I don't have one with me right now. So for the corneal light reflex, I would have the patient look off to the side. I would shine the light in her eyes, and then I would look at the light reflex on her eye, on her cornea eye. And you want to see that the light reflect is in the same place on both eyes. So you wouldn't want to see like one reflect in this corner and on the opposite corner. You want to see them in the same, around the same spot of the eye. Next, you do the pupillary pupillary reaction to light. Again with the pen light, but I don't have it, so I'd have the patient look off to the side. I would shine the pen light in one of her eyes here, and you want to see that the pupil contracts. And then also you'd want to see that the opposite eye that you're not shining the light into also contracts. So I would do it again on the opposite eye. That one would contract, and you would want to see that both eyes contract for this process. Next, we're going to look at cranial nerve 3 again. So we're going to look at accommodation. This is where I would hold an object such as the pen. I would hold it here. I'll have you look at the pen. With just your eyes, don't move your head. Then you move it slowly into their nose. There we go. Then you want to see that their pupils contract and that their eyes cross and look at the object that's going towards their face. Next, we'll look at cranial nerve 2, which is the optic nerve. This is where we would do like a Snellen test. So I'll explain what that is. We'll have a chart with letters in rows. So they'll go from biggest on top to smallest on the bottom. You'll have the patient stand 20 feet away, cover one eye, look with, say, right eye at the chart, and ask them to repeat the words to you that they can read. So they would read the lowest level they can and read the letters out, and then you would test for visual acuity this way. Then they would take the other left eye and see if they can also read the same line or see what line they could read. Next, we would do cranial nerve 8, which acoustic is relating to her ears. We'll be doing the whisper test. So with this test, you want to stand behind your patient about a foot away from them, and then you want to have them close one ear. I'll have you close the left ear. I'm going to whisper something over here, and then I'll have them repeat the words to me, and then we'll do the same thing on the right side. Okay, so you have your ear closed.
Banana, apple, pear.
Yes, and then I'll have you close the other ear.
Bean, avocado, hat.
Okay, and then because she could hear what I was saying and she repeated the words correctly, that cranial nerve is intact. Next, we'll look at cranial nerve 9 and 10, which have to do with her mouth. So we'll be inspecting the movement of her palate. So I'll have her open her mouth. I'll put a tongue depressor on. I'm using a spoon in this case. Push down on her tongue, and then I'll have her say ah, and we want to see the uvula and the soft palate rise symmetrically. So I'll have you open your mouth, put this on your tongue, and I'll say ah. Do it one more time for me. Perfect. And then we find that they do rise, which shows that they're intact. Next, we'll look at cranial nerve 12. So I'll look at her tongue protrusion. So I'll have you stick out your tongue. Then I'll be putting resistance on this one side of her tongue with the spoon. Then have her push against it. Oop, I'll have you push against it. Good. And then did this side? Yep. Good. Then she could do that so that cranial nerve is intact. Lastly, we'll be looking at cranial nerve 11, which is a spinal accessory. So I'll be pushing down on her shoulders, and I'll have her shrug up, see that she can push against the resistance. Okay, so I'll have you push or shrug. There we go. So that's with no resistance, and then I'm going to apply resistance. Have you shrug again? Good. And then that would be a grading of 4 out of 5, since she could shrug up while I was putting resistance on her shoulders. Next, we'll assess her hand grasp. So I'll be assessing them at the same time. I'll just be giving her my fingers, seeing that she can pull down while I pull up, etc. So I'll give my fingers. Oop, you can just like hold it like that. Perfect. Then I'll be squeeze, and then I'll be pulling up. I want you to pull down. Good. Okay, I'm going to push down, and then you can push up. Okay, good. So she's good with that, and then we'll assess her lower extremity strength. So I'll just have her push her thigh against my hand as I apply resistance downward. So you can push up. This is no resistance, and then I'll put you down. Then I'll apply resistance on her leg. Then you can push up against it. Good. So she didn't let me push her leg down, and she put up against the resistance. And that is the last test, and I will ask the patient if she has any questions or concerns. Do you have any questions or concerns about your assessment today?
No.
Okay. And then that's it. You would tell them the results, that they passed through everything and that their cranial nerves are intact.